Hi, it's Dr. Irving here, GP and clinical lead for the COVID oximetry at home service in St Helens. Just wanted to give you a quick update about this service that's now live and being provided through primary care in St Helens. It essentially relates to one of these devices, which is a pulse oximeter that can check your blood oxygen levels. Essentially, this service aims to detect the early signs of deterioration in patients diagnosed with COVID-19 so that they can be managed appropriately. We have good evidence that patients at risk of poorer outcomes from COVID-19 can benefit from having the reduced oxygen levels identified earlier in the course of their illness. We have good evidence that highlights that patients who have lower oxygen levels at initial presentation are associated with poorer outcomes. If we can identify these patients with lower oxygen levels early on, we now have proven treatments that can improve survival rates. The way the service will operate in St Helens is essentially once an individual has had a test, and if they're positive, the service will notify their GP and they will essentially be referred into the service should they meet the eligibility criteria. Currently that criteria includes individuals over the age of 65, people under the age of 65 but in a clinically extremely vulnerable group, or under 65 and have high risk factors such as high body mass index, have multiple medical problems, their ethnicity, or patients with learning disabilities. Once a patient's recruited into the service, essentially they will be sent out a pack much like this one. This includes a pulse oximeter, and it also includes a patient information sheet which contains everything you would need to know about the service, how the service operates, how to use a pulse oximeter, and how to record your readings and what to do if those based on those readings. We're also looking to roll out a digital service that can use a text-based service where patients can send in their oxygen levels through the text service so that we can be informed as quickly as possible and take the appropriate action. If you have any questions, then please let us know. Thank you.